Today's topic is ulna. Ulna is the medial bone of the forearm. It is homologous to fibula, and in anatomical position, the ulna is found in the medial forearm, while the radius is found in the lateral forearm. Here we can see in ulna it has an upper end, a shaft, and a lower end. Now talking about upper end, it has two processes, olecranon and coronoid process, and has two notches, trochlear and radial. For processes olecranon, it has 5 surfaces, that is superior, anterior, which form upper part of trochlear notch, posterior, which forms subcutaneous olecranon bursa, medial and lateral. For coronoid process, it has 4 surfaces, that is superior, which forms lower part of trochlear notch, anterior, which lower corner forms ulnar tuberosity, medial and lateral surface, which has a radial notch in upper part and has supinator crest in lower part. Now talking about shaft, it is firmly connected to that of radius by dense connective tissue called the interosseous membrane. It has 3 borders and 3 surfaces. For borders, there are anterior, posterior, and interosseous/lateral border, which is sharpest. For surfaces, it has anterior, posterior, and medial. Now talking about lower end, it has a head and styloid process, and between them there is a groove for tendon of extensor carpi ulnaris. Head articulates with ulnar notch of radius to form inferior radio-ulnar joint. Styloid process provide attachment of ulnar collateral ligament of wrist joint. So this is gross anatomy of ulna. Now for the side determination of ulna, we will look for 3 point. First is upper end, second is shaft, and the last point is lower end. So, point number 1, the upper end is hook-shaped and its concavity is directed anteriorly. Point number 2, its shaft consists of a very sharp border, which lies laterally. Point number 3 is that the lower end of the ulna has this projection called styloid process located posteromedially. This is the ulna of right side. Finally, the muscle attachment. The triceps brachii is inserted into the superior surface of the olecranon process. The brachialis is inserted into the anterior surface of the coronoid process, including the ulnar tuberosity. The supinator arises from the supinator crest and from the triangular area in front of the crest. The ulnar head of the flexor digitorum superficialis and the pronator teres arises from the medial margin of the coronoid process. The flexor digitorum profundus arises from the upper 3/4 of the anterior and medial surfaces of the shaft, the medial surfaces of the coronoid and olecranon processes, and the posterior border of the shaft. The pronator quadratus takes origin from the oblique ridge on the lower part of the anterior surface. The anconeus is inserted into the lateral aspect of the olecranon process and the upper 1/4 of the posterior surface of the shaft. The lateral part of the posterior surface gives origin from above downwards to the abductor pollicis longus, the extensor pollicis longus, and the extensor indicis. This is muscle attachment.
If you want the note, please comment down below.